This is Dr. Howard Rollins. I'm at Las Vegas 2012 HIMSS conference, and I have the pleasure of speaking to SteveTolle. Steve is the Senior VP of Solutions Management for Merge Healthcare. So here we are at HIMSS. Tell me why you're here and what's exciting with Merge.
So we're here at HIMSS essentially promoting our brand and promoting this message about enterprise image interoperability and enterprise imaging strategies for hospitals. So if you think about images in medicine, we believe that they're the truth in medicine. So if you're going to see an orthopedic surgeon, a cardiologist, an oncologist, an ophthalmologist, a dermatologist, they're looking at an image, and that image and what they see can have a significant impact on your life and your care. So we are working with hospitals now, focusing on, you've got enterprise strategies for CPOE, you've got enterprise strategies for supply chain management, but you don't think about enterprise strategy for image management. And when you think about a typical hospital, they have multiple PACS systems. Each department has their own PACS system. They don't talk to each other. In one delivery system, they might actually be sending CDs across the street because they can't talk to each other effectively. There's significant opportunity to improve efficiency, and so we're here talking to hospitals about that.
And interfacing is kind of the buzzword now. It's everything, isn't it? Or interoperability.
Interoperability really is the key. When you think about two things, a third of imaging done in the country is considered to be unnecessary. So if you take a classic example, someone gets hurt, they go to the ER, they get a scan. That ER might not be affiliated to the place where they're going to get their ultimate treatment. So when they go in and have to see the orthopedic surgeon, for example, they're going to get another scan. Was that scan really necessary? And did the patient really need to be exposed to additional radiation? So it really comes down to unnecessary images and unnecessary radiation exposure, and how do we improve patient care ultimately and manage costs out of the system.
Now, Merge has been involved in imaging for quite a while, haven't they?
Yeah, so Merge actually helped found the standard that all imaging uses, which is called DICOM. And so we're a global company. We have headquartered in Chicago, we have offices in Toronto, we have offices in France and in China. We have worldwide distribution relationships with very large manufacturers who embed a lot of our technology in the equipment they sell. So we're well known in the DICOM world as being a setter of standards.
And you have some rather prestigious clients, don't you?
We do. You know, we have 1,500 hospitals. We all have most of the top 20 hospitals in the country as our clients. We have 6,000 ambulatory clients as well, so about a third of the diagnostic imaging centers in the country, and about half the orthopedic surgeons in the country. So we've got a very diverse client base, a lot of specialty care.
And my understanding is you have many products that are vendor neutral. You're able to interface with other people's products. Is that correct?
Yeah, so that's the reality in most hospitals and in most communities is that they don't have a single vendor solution. They've purchased over time from different players, whether it's GE packs or Fuji packs or Merge packs, and so we have to be able to talk to multiple systems. So we have a vendor neutral archive, we have a vendor neutral viewer, which is, we call it our iConnect Access viewer, and that's about how do you get your referring physicians in the community to be able to interact with the radiologist to not only see the report but see the image and show the image to the patient so that they actually understand, why do I need to have this procedure on my heart, for example. So we have to deploy this product on iPads. It's a web-based product, so you can watch it on a browser. But we have to read images from any PACS system that's in the community.
Now, when you are interfacing with other vendors' products, is security an issue, or have you solved that issue?
So we have solved that challenge. When you think about the cloud as an example, and the cloud's getting pretty crowded because when you're at HIMSS this year, everyone's talking about the cloud.
Right.
But it poses certain challenges that you didn't typically have when you're deploying a system on-premise at a hospital. Typically, physical security for a hospital managing their PACS and their archive was sufficient. You can lock the door and you don't have to worry about who's getting into the building. When you're in the cloud, you don't have that ability to control things, so we have to focus on things like encryption. We encrypt the data at rest. And so we've done a lot of R&D investment around how do you make sure you've got the right level of security with the right level of performance, and then how do you also manage things like you've got a standard called DICOM that's not always exactly the same. So when you've got an image coming from a GE PACS and an image coming from a Fuji PACS, all using the same standard, they don't always actually have the same exact format. And so we have to be able to change those formats, switch things around so that we actually can be vendor neutral.
Is implementation, has it gone well? I would imagine there's lots of challenges there.
There are always challenges in implementation. You know, the good news is we've done it enough, so we have the playbook, so we know what the nuances are around if we're working with a GE system or a Fuji system or an AGFA system. We've done it enough where we know what the challenges are going to be when we do this. But you know, when you're moving petabytes of data from one system to another, this is complicated work.
Merge does have the capability of going into a facility that has nothing yet and completely outfitting that facility. Is that right?
We do. That's a rare occurrence. Most of our business is a replacement, natural life cycle evolution. I've got a hardware refresh. It would be a great occurrence. In some specialties like ophthalmology, for example, in the outpatient world, we're very unusual in that we can actually outfit an entire ophthalmologist's office. So we can actually sell them the attachments to their cameras, sell them the cameras. We can sell them the PAC system to manage the image. We can sell them the software they use to see their patients, electronic health record, and the billing system. So we actually do that in both orthopedics and ophthalmology, where it's I call it a wing-to-wing solution, and very few people actually do that.
Can you tell me a little about iConnect Access?
So iConnect Access is our zero-footprint web viewer. It's part of our iConnect stack, which includes a vendor-neutral archive and a share functionality. So it allows in a community...
That's for sharing images?
It's for sharing images between physicians.
Okay.
So it allows in a community the ability for a referring physician to receive an image from the radiologist, zero footprint on their desktop. So they're just using a web browser. They're seeing the same image the radiologist is seeing. Right. They don't necessarily need all the same measurement tools, diagnostic tools, but typically a radiologist will look at a series of images and pick the images, the key images that they want the referring physician to see, and that's what they're going to look at.
And the physician can see that on their mobile device? See
it on their iPad, see it on any browser that they have access to.
I'm rather familiar with your HIMSS product, and how does HIMSS fit into your whole plan?
So as a business, we're very focused on how do you deliver services and products to hospitals, in addition to our large ambulatory base. So when you think about the HIMSS product, it's a foray for us, an additional extension into the hospital. You'll see us doing more in the hospitals later this year, I would guess.
I know that HIMSS really doesn't have great market penetration now, but I see a big change coming. In fact, I was mentioning that the other day to the chief of my anesthesia group, who took over for me, and rather brilliant man, and he never heard the word HIMSS before, and he's in a community setting. It's amazing, isn't it?
Well, I think of it as where the EMR industry was 5 years ago, right? So we all dreamt for years that you'd have this massive push to adopt technology, and now we're seeing that. In these specialized departments like anesthesia, the large hospital systems, some of them have solutions, but when you're talking to someone who needs a very specialized workflow, HIMSS is an incredible product that not only manages the workflow, manages supplies, which is a big part of that job. It's a very important thing to make sure they have the right workflow when they need it.
So to sum up our conversation, let's say that I'm a physician who the hospital has asked to help them find the right solution for their facility. And I come to you and I say, Steve, sell me, why merge?
So I would say that we're the leader in imaging nationwide. It's a very complicated thing to do. So when you look at health information exchanges, electronic health records, and you think about how important the image is in medicine around getting the right treatment, the right diagnosis, the right treatment for a patient, you can't practice at this. You have to be an expert. And so we want to image enable electronic health records, hospital systems, health information exchanges. And we don't want to have people learn on the job. We know what we're doing, we've been around, we help define the standard. And so we're expert at this, and we hope to help others who don't need to become the experts in this market.
Thank you. Steve, thank you very much.
Thank you.
It's really a pleasure talking to you. SteveTolle, Merge Healthcare. Thank you.